Is known as National Trauma Awareness Month. That's why today in this particular segment of Ask the Experts, we're focusing on trauma. Dr. Nelly Garcia Blow with the Christus Spohn Trauma Center is here now and joins us to talk to us a little bit about trauma, specifically when we're dealing with our senior citizens. You are a geriatrician, which is a doctor who deals with trauma with folks who are senior citizens. How big of a problem is it, obviously, in Corpus Christi or South Texas?
I think all over the country, with the population aging and having baby boomers, we're having older patients, and so now we're seeing where trauma, people used to think of younger patients, and now about a third of our admissions for the trauma center are geriatric patients. And people wonder, what age? Does that mean I'm geriatric? And so most people look at geriatrics as 65 and older, but in trauma it's actually 55 and older, because we know that the mortality doubles at that age. And so about 45% of our trauma admissions, once you talk about 55 and older, are actually geriatric patients.
What kind of injuries are we talking about?
Sure, and so the big serious injuries are traumatic brain injury and falls. And falls is especially our most common injury. And in older patients, a fall that could be for you and I, perhaps not such a big deal, but in an older patient, a very low velocity fall, just from sitting or standing or even falling from a bed, can lead to serious injury.
Sure, and they're sometimes they're able to recover?
Yes.
Some do not.
Exactly. Exactly. And so the big reason why we always talk about fall prevention is because of the mortality that we know is associated with, for example, a hip fracture.
Sure.
And sometimes you think that mortality ends in about a year, but really we see it follow through them for 5-10 years down the road, that it still affects their morbidity.
No doubt. And then, of course, they deal with the pain afterwards, because we often hear that they're just never the same after this.
Exactly, exactly. And I think the functional status of the patient beforehand, we always try with fall prevention is to say falls are not a normal part of aging. And that's the most important thing. An 85-year-old who's very healthy does not have an increased risk of fall compared to a 65-year-old. And so getting that exercise, getting stronger, preventing that fall is so important, because once you actually have that serious injury, it's so much more difficult because you have comorbidities and, like you said, pain and everything else that they deal with.
Preventing the fall, that is the topic we're going to discuss in just a couple of minutes when we come back, as we ask our experts. Will you hang out with us, please?
Yes,
All right,
will do. Thank
Doctor.
you for having us.
But still